If you or someone you know is preparing for spine surgery, one of the biggest concerns is pain management, what to expect, how to handle it, and what's normal. Today, I'm going to break it all down so you know exactly what to expect before, during, and after surgery. One thing I will always tell my patients, pain after surgery is normal, but there is a plan to manage it effectively. So let's get into it. Pain is a natural part of the healing process. Think of it like this. If you get a deep cut on your hand, you wouldn't expect it to stop hurting overnight, right? The same thing applies to your spine surgery. Your body is repairing itself. But here's the good news. We have strategies to help control pain and improve your recovery. Number one, stop narcotics before surgery. One of the most important things you can do before surgery is to stop taking narcotics. Why? Studies show that patients who take narcotics before surgery often have a harder time managing pain after surgery. Why? Because we use the same medications. It makes it much more challenging to achieve a long-lasting, worthwhile recovery. If you're currently taking narcotics, we can discuss alternative treatments to help ease your transition. Number two, enhanced recovery after surgery protocol. Pre-surgery medications are often given, and we follow an evidence-based approach called enhanced recovery after surgery to help smooth the transition from pre-op to post-op pain management. This includes medications like Lyria, which helps with nerve pain, Tylenol, which reduces overall pain levels, Celibre, which is a strong anti-inflammatory drug. These medications all help reduce pain before it even starts. Number three, Exparel. Pain control during surgery is important. We use medications to help manage pain even before you wake up. One option is Exparel. This is a long-lasting pain reliever that's injected and reduces the need for narcotics after surgery. It is a bit controversial due to its costs, but high-level research shows that it's effective in reducing post-operative pain and reducing narcotic use. While you're under anesthesia, there are medications that can be given to you to help control your pain as well. These range from narcotics to local anesthetic to other medications like Precedex is a good example, ketamine is a good example, lidocaine drip is a good example. These are all medications that can be used as part of the ERAS protocol to help with your pain control while you're under anesthesia. Talk to your anesthesiologist before surgery if you have any questions about these. Multimodal pain control after surgery. Once surgery is over, we use a multimodal approach, which means combining different types of medications to control pain without relying heavily on narcotics. Here's what that looks like. Tylenol for baseline pain relief, Toradol, a low dose of an anti-inflammatory, Robaxin, a muscle relaxer, gabapentin for nerve pain, narcotics, if needed, for breakthrough pain. Not all patients require narcotics, and I make it a priority to limit their use as much as possible. Why am I still in pain after surgery? This may be a question you ask. So let's say you've had spine surgery and you're still in pain. Naturally, you're wondering, did something go wrong? Was the surgery a mistake? First off, let me try and put your mind at ease. Pain does not always mean something is wrong. For example, I had a patient with a severe spinal cord compression in his neck. He had terrible pain in his hands before surgery. And while it improved afterward, his pain score wasn't 0 right away. Why? Because the spinal cord and nerves take time to heal. Surgery relieves pressure on these nerves and the spinal cord, but it doesn't instantly erase pain. Healing is a process, and your pain should gradually improve over time. What if pain lasts longer than expected? So if pain lingers longer than it should, we have a few options. One, physical therapy and rehabilitation. We can strengthen the muscles around your spine, and this can take pressure off of the nerves and also help improve mobility. There are pain management options. This includes medications, injections, and other non-surgical treatments. It's also important for reevaluation. If pain isn't improving, we can order further imaging, like an MRI or a CT scan to see what's going on. Sometimes it's important to order an MRI or a CT scan if you're in pain, and your surgeon should do this. If you're having pain and you don't feel like something is normal or something's not right, tell your provider. Let them order the imaging that is necessary to help put your mind at ease. Sometimes it will show something that we didn't recognize. Lifestyle adjustments are important. Small changes in things like posture and even movement can make a huge difference. My final thoughts for you. What's the bottom line? Spine surgery is a journey. It is not an overnight fix. Surgeons don't fix you. We help improve your condition, but healing takes time, and it's important to be patient in this process. The key is communication. Talk to your doctor, ask questions, and don't ignore persistent pain. If you found this helpful, I share a lot more spine health tips on this channel. Please hit like, subscribe, and drop a comment below if you have any questions. I'd love to help.